So I'll start my talk.
Yes.
So as I told Professor Banu Madam, is the motive behind this social aspect of epilepsy, because we always talk about types of epilepsy, management, epilepsy surgery and all. So gave me an opportunity to go through most of the many literature available, not only in India and other parts of the world, and the current concepts and what's going on, what happened in the past about epilepsy and marriage, and which is very, very important question we face in our day-to-day practice. Um, People with epilepsy had lower marriage prevalence rate, delayed marriage age, withheld marriage, and higher divorce rate compared to general population. So when we see these people, we see them from the childhood, then they become adult, then they touch the marriage age. A lot of questions we face on every day, starting from the childhood up to the marriage, after marriage, pregnancy. So it is not a very simple topic to discuss with the patients. It has a lot of emotional component attached to it. Sometimes it is difficult scenario we have to face, because a lot of people that are ask the consultant is only single person available to answer so many people questions. So many questions are difficult to answer as well, no? Like very sensitive questions. So they have a lower marriage prevalence rate and delayed marriage age, withheld marriage and higher divorce rate. Marriage rate was lower in people with the age of onset of epilepsy less than 20 years with seizures not in remission. So if you see a person who have the epilepsy from childhood and they are getting recurrent seizures, the marriage rate was lower in this population. Majority of people with epilepsy did not disclose epilepsy before marriage. That is the question they ask you, doctor, can you tell the people that I have epilepsy, or what to tell, and can you reveal? And they ask you something, and what they do, we don't know. And it is not that easy, because we can't give a standard recommendation to this patient. But as a doctor, we always tell this better, because I'll tell some of the important papers in the coming slides, and the importance of revealing the disease to the people. And the majority of people with epilepsy did not disclose epilepsy before marriage. Fertility is not affected in people with epilepsy as compared to general population. Males had lower fertility than females. So the important thing they ask is, if you get married, can I lead a normal life? Can I have a baby? That what will happen to the baby, or whether a baby fertile? All these questions. But the data says that their fertility is reasonably good enough compared to the general population. The males had lower fertility than female, because we know some of the drugs like sodium alpide can affect the sperm count and other issues as well. But the fertility is not much lower. There is a little lower in male compared to the females in people with epilepsy. In a study of 100 patients, 58% informed prior to marriage. 58% of population, they told that there are different studies, different data, different statistics. So I'm just telling that what all the papers published in the literature. 58% informed prior to marriage and 42% concealed it. Attitude of the husband was negative in 33% of the concealed group. So those who concealed it, and the attitude of the husband, once it comes to the surface, that it was negative in 33% of the concealed group. Statistically significant marital outcome was observed in concealed group. So the marital outcome is different compared to the concealed and non-concealed group, actually. So that majority of patients in both group find that it should be disclosed prior to the marriage. They accepted on questionnaire that they should have disclosed. Those people not disclosed, they told they disclosed. The people disclosed, they told that, okay, at least I'm happy that I have disclosed that I have seizure before marriage. So there is an epilepsy marriage bureau in Pune, which celebrates 10 years in Pune. I don't know how many of you are aware of that. There is a marriage bureau, and they have registered epileptic people, and they find a pair for them, actually. They celebrated 10th year of starting the bureau in Pune. I don't know whether we have any similar organizations in other places as well, but I think what I found from the net is Pune is having an epilepsy marriage bureau. So the Kasumaru Wada et al., they told the marital status of adult patients with epilepsy who did not have mental retardation. And they taken people with a normal IQ. So they taken 278 patients. Out of that are 142 are men, and 136 are were women. 66 men and 52 women are single. So if you add on this population 278, out of that 66 men and 52 women are single. 76 males and 84 females had been married. This is the basic statistics of the patient population in the particular study. Proportion of patients in whom seizures were controlled at the time of marriage. So they looked into how many people had a good control of seizures at the time of marriage. 30% were men and 22% were women. These results showed many patients' seizures were not controlled when they are married. So that is an important question. So people are not doing well with seizures, they're getting recurrent seizures. It plays a major role in the epilepsy and marriage. But 30% are men and 22% are women. I think my patients who I see, that I don't see that so low actually. I think many are well controlled. Maybe it all depends upon whether it's institutional data or private practice data, or what kind of patient the individual practitioner is seeing. But I don't know. I'd like to know from Professor Bhan and Professor Geeta Lakshmipathy in the future what they see in the private practice and the institutional practice. It's so low actually. But according to this study data, that many patients are not well controlled at the time of marriage. Seizures themselves may not markedly inhibit marriage. So let's see, epilepsy alone is not the reason. People want to get married, they get along with life, they want to lead a normal life. So many other factors plays a role that what makes them to get married, and how the marriage is successful. So many other factors apart from seizure plays a role in success of the marriage and getting the chance of getting married. Total 29 patients, 13 men and 16 women had experienced divers. Out of this 200 plus data, 13 men, 16 women had experienced divers. Epilepsy was the cause of divers in 7 in 29 patients. So 22 patients, epilepsy alone is not the cause. There are so many other factors as the cause. Of the 7 patients, only 1 patient had informed the spouse of the disease before marriage. So the disease, the people who had a diver, the common thing is the concealment actually. And even then, that 7 had epilepsy alone is the cause. And as I told, that so many other reasons apart from epilepsy alone, the personality of the person, the behavior, so many things plays a role in the cause of divers. We should not always think the epilepsy alone is the cause. The remaining 6 patients, seizures are witnessed after marriage, or the disease was revealed by medication, which resulted in divers. So these are the concealed group, and they witnessed the fits happened after marriage. They started taking medication, and then the concealment was revealed to the partner. Association between marriage and the job. Close relation was found between the presence or absence of marriage and the presence or absence of job. So if they have they are married and they have a job, and they have their job, they have studied, educated, they have a job, and they are financially sound. These people do well with marriage and other issues, because the most of the problem happens in less educated, not having a job, and less IQ people with other comorbid factors. They have more problem with epilepsy and marriage. Influence on marital status and the quality of life of Chinese adult patients with epilepsy. This is paper on influence on marital status and the quality of life of Chinese adult patients with epilepsy. Married adult epileptic patients have a better quality of life than that of unmarried adult patients in young and middle age group. So it's very, very important. Is someone ready to get married, and another person understand it, they better get married, because they do better compared to the people who are unmarried, because there are so many advantage or benefit of getting married. Unmarried adult patients with epilepsy are more anxious and depressed than married adult patients. So marriage gives a lot of security, usually in ideal marriage. And then they have people to take care of them, apart from even though they do well alone. But people who are single and not married, and they are more depressed and anxious with epilepsy. Epilepsy was removed from the list by an act of parliament in the year 1999. So I think that when you have free time, read about the Indian Marriage Act 1954 and 55. And until 1976, there was a problem. The Indian Epilepsy Association put a case in the court, and a lot of things gone in the court between our epilepsy society and the lawmakers. And subsequently, in 1999, and epilepsy was removed from the list. During the debate, it was pointed out that it is inhuman to equate epilepsy and insanity together, as 80% of the cases of epilepsy are treatable. So when you have treatable condition, patients can become better, and they are otherwise okay. And putting them as a reason for a divorce is inhuman. I'll tell what happened in other parts of the world. You'll be surprised that it is not only in India, but we took it a little later. It took up to 1999 to come to this decision. Patients are able to live normal life with proper treatment. So when they are treatable and when they can lead a normal life, and telling that as a reason for divorce in an ideal situation, it's not right. That's why it was removed from the epilepsy was removed from the list. Matrimonial Causes Act 1937. The annulling a marriage means that in the effect the marriage never took place. You know that these are legal terminology. Annulling a marriage means it is equal to the marriage never took place. In 1971, the Nullity of Marriage Act removed epilepsy as a ground upon which marriage could be voidable. So in 1971 itself, in Britain, they removed that. It was removed as epilepsy as a cause, and it was there in other developed nations also. There was issue with epilepsy and marriage, because the act was quite in the past, and in 1971 they made the decision. Epilepsy, Indian League Against Epilepsy 2003, the history and stigma of epilepsy. People with epilepsy were forbidden to marry in 17 states until 1956. This is in the United States, and the last state to repeal in 1980. So until 1980, there's a problem. The people with epilepsy were forbidden to marry in 17 states until 1956, and the last state repeal was in 1980. So the impact of marriage and social support on persons with active epilepsy. Epilepsy behavior, the article 2011. Persons with active epilepsy who are not married with poor support were significantly less likely to report better life satisfaction after controlling for demographics, comorbid conditions, and the poor mental health status. So it's important. Somebody with epilepsy who are doing well, and even if they are doing well with medication, whatever it is, and marriage gives a lot of advantage compared to people who are not married and living single. Traditional practices and perceptions of epilepsy among people in Roma communities in Bulgaria, epilepsy behavior in 2020. Majority of children with epilepsy are likely to leave school yearly, are generally limited in their choice of spouse, particularly girls, and marriages often occurs between people with epilepsy or those with a family history of epilepsy. So that is the thing that people getting married among epilepsy or those families with epilepsy. I think that in ideal situations that we know the different reasons for epilepsy, and this is the data of a particular place. Multi-sectional cross-section study, people with epilepsy of 374 patients. Marriage rate was 27.3% and divorce rate was 54.8%. So we have to keep in mind it's a multi-sectional cross-section study. Divorce rate in women was significantly higher than in men, 62.6% versus 46.4%. And there was no significant differences between the different types of epilepsy. So this data says that what are the type of epilepsy. But I think earlier the onset of epilepsy and genetic epilepsy, refractory epilepsy, patient taking multiple medications, I think there should be some different. But being a cross-sectional, multi-sectional study, I think that the overall large data can give sometimes a different presentation. But we have to keep in mind, obviously, that all the other factors also play some role in the data. The psychosocial impact of epilepsy and marriage is a narrative review. The impact that seizure have on the partner of a patient with epilepsy is badly addressed. So we know that we are talking about epilepsy, epileptic patients, psychosocial impact, and their care and their marriage and the divorce and all those things. There are also other data which need a study that impact the seizure have on the partner of a patient with epilepsy is badly addressed. I think it needs a lot of data analysis, and they also need to be educated because for a good outcome in the future. Increasing incidence of epilepsy in older populations, potential changes in the dynamic of a long-term marriage with the development of epilepsy in older age are not known. So there are also we need a lot of data about people getting epilepsy in the later part of their life because they married, they're not at epilepsy, they're getting epilepsy at the middle age to late age population. Then you need what happens to that pair and on the long-term dynamics of their personal life, and all those things need data because we are more focusing into marriage, pregnancy, and all those things early part of life. What happens in the later part of life also needed a large amount of study. I think these need to be addressed in the future. So fertility and marital status in adults with childhood onset epilepsy, a population-based cohort study. There is interesting study on childhood onset epilepsy published in Epilepsy at 2019. Patients with childhood onset epilepsy had a lower fertility rate and fewer marriages. As I told that the people know they have epilepsy for quite a long time. It's childhood onset epilepsy. They have more impact of epilepsy on them. The larger impact was in patients with childhood onset epilepsy who had any disability, symptomatic etiology of epilepsy, an onset of epilepsy before 2 years of age, and high seizure frequency after start of treatment. All those things may play a major role. High frequency seizure, early onset epilepsy, symptomatic epilepsy, disability, seizure with a disability, All those factors are very important role in finding out what impact it has on them on a long term. Patients with child onset epilepsy without any disabilities had only slightly lowered fertility and a non-significant reduction in marriages. So they have no disability, and people who do well and all those things, they are better psychosocial outcome. Women with onset of epilepsy prior to marriage disclose or conceal. It's epilepsy at 2007. I think this our data is published here. And epilepsy clinic in Kerala, 82 women, 55% concealed and 45% disclosed. Compared to those who disclose the prevalence of divorce, separation and distant marriages are significantly higher among those who conceal. Obviously, we know that how things work out in our place, and people who concealed obviously have a bad outcome compared to people who disclosed. Because the people who disclose, they already things are known and there's a better understanding. So that makes a difference to the people. Sex differences in marital status of people with epilepsy in Northeast China, an observational study in epilepsy behavior in 2020. 475 participants, out of the 219, 79.6% men with epilepsy are married and 140 women with epilepsy are married. And age, education level, the age at onset, I think that 140 women, I think that also comes around 70%. So there is not much difference actually, men little more than the women. Age, education level, age at seizure onset, and disease duration were significantly different between the married men and women compared to the single men with epilepsy and women with epilepsy. So there is a difference in the age, education level, seizure onset, disease duration, in people who are married compared to single people with men with epilepsy and women with epilepsy. Marital status after epilepsy surgery. This is a very important study because we always talk about people with epilepsy, symptomatic epilepsy, child onset epilepsy. What happens to these people after epilepsy surgery? In Epilepsy in 1990, it's a US-based study. Marital status in 430 epilepsy surgery patients and in a subset with temporal lobe epilepsy. They taken mainly temporal lobe epilepsy patients. Because we know that most of the surgery happens for TLE. Patients who had 4 or more years of post-surgical follow-up are examined for change in the marital status after surgery. That is, they taken people who had a surgery 4 years back, 4 or more years post-surgical follow-up. Men with epilepsy, women with epilepsy, temporal lobe epilepsy had higher marriage rates than those with extratemporal epilepsy. More than 4 years after epilepsy, surgery patients who had no recurrent seizures are likely to change marital status than those with recurrent seizures. So the people who do well after the surgery, both cognitively and seizure-wise, and then there is a change in the marital state. I think we need a further depth study to find out what really changes that. We know that some reasons, but it is important to look into the sub-aspect of that. So the temporal lobe epilepsy patient had a higher marriage rate compared to extratemporal lobe epilepsy. We know that GTCS and all those things is more obviously seen, and TLE is not much seen outside. Seizure-free women were more likely to divorce. That is number is 9 than were seizure-free men. And this is the outside data, and we have to find our own data. Most men who married were employed, 77%, compared to women who divorced were unemployed, 67%. So education, age at onset of seizure control, and job. Job plays a major role in empowerment, both men and women. Those who studied, who are cognitively good and doing well, making earning their livelihood, and this may not be a big disablement for them, and they can get along with life because they are empowered. The abolition of seizures by epilepsy surgery creates new opportunities for changing social relationship. And as I told that, this data in different setup is different, and obviously people suddenly becoming normal, and they are doing well, and the environment changes, and it makes a change in their social relationship. Location of epileptic focus may influence psychosocial function. So we know that where the epileptic focus is there, it decides the psychosocial function of the particular patient. So that's it, and I just touched some of the important paper published. So I talked about the issue of marriage, epilepsy in marriage is both for men and women, and in different countries, depending upon the cultural, social practice, and the perceiving data differs about concealed and non-concealed marriages, and the empowerment of job, education, and the role of age, and age at onset of seizure, and control of seizure, and what is the role of what happens after epilepsy surgery in marriage, and other issues I discussed on quoting the important papers published. And I'll be taking questions at the end of Dr. Arulmoni